Day 4 of our anterior tooth dental anatomy marathon. We're going to be looking at the fourth and final incisor, the mandibular lateral incisor. If you haven't seen my other videos on the incisors, check them out. We've already gone over the maxillary central incisor, maxillary lateral incisor, and the mandibular central incisor. Hello, I'm Dr. Clara. I'm a practicing dentist and your new dental study coach. I'm taking mountains of textbooks and information and turning them into short, easily digestible videos to make your studying a little bit easier. Speaking of studying, do you have a tooth identification test coming up? Well, I have a strategy that's going to help you ace that test. Steal my 5-step tooth identification cheat sheet in the description below. There are two mandibular lateral incisors, the right and the left, and those are numbered 26 and 23 using the universal numbering system. The mandibular lateral incisor is one of 4 types of incisors, and the last incisor we're going to be talking about. The mandibular lateral incisor is second from the midline on the mandibular arch, distal to the central incisor. The mandibular lateral incisor has an incisal ridge and no cusp. The mandibular lateral incisor is larger than the mandibular central incisor in the same mouth. The crown is taller, wider, and the root is longer. The mandibular lateral incisor is also less symmetrical than the mandibular central incisor. The function of this tooth, same as all the incisors: bite, cut, shear food, help with aesthetics, support the lips, and help with speech. The mandibular lateral incisor erupts at ages 7 to 8. The root completes 3 years later at 10 years old. And the initial sign of calcification happens at 3 to 4 months. Let's look at the mandibular lateral incisor from the facial. Like all incisors, the crown is shaped like a trapezoid with the larger base at the incisal ridge and the smaller base at the cervix, so that it's tapering from the incisal ridge to the cervix. The crown is taller incisal cervically than it is mesial distally. The mandibular lateral incisor crown is larger than the mandibular central incisor crown in all dimensions. The mandibular lateral incisor has an incisal ridge and no cusp, so that the incisal outline is straight, with a slight sloping to the distal. If the tooth isn't in function or freshly erupted, there may be 3 bumps on the incisal ridge, which are mamelons, and those correspond with the 3 facial developmental lobes. The mesial outline is straight. The mesial incisal angle is quite sharp. The mesial height of contour or contact is in the incisal 1/3. The distal outline is more convex than the mesial. The distal incisal angle is more curved and obtuse than the mesial, and the distal contact is more cervical than the mesial, though it's still in the incisal 1/3. The labial surface is smooth and relatively flat, and those developmental depressions that we saw on the maxillary incisors is unlikely. The root of the mandibular lateral incisor is quite narrow mesial distally. The outline of the root is going to be straight and match the outline of the crown of the tooth, and just continue to narrow until it reaches the apex. There is a bend to the distal at the apical 1/3, though there can be some variations where it's straight. The root of the mandibular lateral incisor is longer than that of the mandibular central incisor. Now let's flip this tooth over and take a look at the lingual. The outline of the mandibular lateral incisor is going to be the same but reversed as it was from the facial. The lingual surface of this tooth, similar to the mandibular central incisor, are going to be quite smooth and flat, even smoother and flatter than the mandibular central incisor was. The mandibular lateral incisor has the least defined lingual anatomy of all the anterior teeth. There's going to be a very weak, very shallow lingual fossa, bordered on the mesial by a very slight mesial marginal ridge, to the distal by a very slight distal marginal ridge, and to the incisal by the lingual aspect of the incisal ridge or the lingual incisal edge, and then bordered cervically by a very slight, poorly defined cingulum that's going to be displaced to the distal. There are not going to be any grooves or lines to the lingual surface of this tooth. The root and crown of this tooth are going to taper lingually, so that the mesial distal dimension of the facial is going to be larger than the mesial distal dimension of the lingual. It's going to narrow or taper from the facial to the lingual. It's going to be easier to see from the incisal, but first let's look at the mesial and distal features. This is the mandibular lateral incisor from the proximal view. This is the mesial, this is the distal. The crown is triangular or wedge-shaped with the base at the cervix and the apex at the incisal ridge. The facial outline is convex from the cervical line to the height of contour at the cervical 1/3, and then it's straight up until the incisal ridge. The height of contour is at the cervical 1/3. The lingual outline is S-shaped, convex over the cingulum, and then concave to the incisal ridge. The height of contour is at that cingulum and the cervical 1/3. The cervical line, or the CEJ, where the crown meets the root, has a curve towards the incisal. The mesial is more prominent than the distal. For the mandibular lateral incisor, the incisal ridge is going to be lingual to the long axis of the root. And if the mandibular lateral incisor has wear facets from incising against the maxillary incisors, it's going to have a labial inclination. The outline of the root is straight down from the cervix and then starts to taper at the apical 1/3. The root is quite wide facial lingually compared to mesial distally, giving it a ribbon-like shape. And there's going to be broad developmental depressions on the mesial and the distal, with the distal being more prominent. Let's look at this tooth from the incisal. From this view, the tooth could be considered diamond-shaped, with a tapering from the incisal ridge to the cingulum. This tooth is wider facial lingually than it is mesial distally. The incisal ridge is going to be lingual to the center of the tooth. Now, the mandibular lateral incisor, unlike the mandibular central incisor, does not have bilateral symmetry. What that means is the mesial is not identical to the distal. There's a distolingual twist to it. So if you drew a line bisecting the crown facial lingually, the incisal ridge is not going to be at a right angle to it. The incisal ridge is going to look twisted so that the distal goes lingually. Another way of seeing that is if you position the incisal ridge horizontally to your eye level, the cingulum is going to be displaced to the distal.
Attention dental students. This distal lingual twist of the crown of the mandibular lateral incisor is an important characteristic that distinguishes it from the mandibular central incisor. You can see the twist, or the rotation of the crown to the root, from both the incisal and the mesial view. From the incisal, you can see the twist because you can see the cingulum displaced to the distal, or depending on how you angle the tooth, you might see a distal lingual twist to the incisal ridge. From the mesial view, you can see the twist when you look at the crown because you can see the distal aspect of the lingual surface peeking over the corner. Characteristics used to differentiate between the mandibular central incisor and the mandibular lateral incisor include which of the following? Let's go over these options together. A, the mandibular central incisor crown is rotated on the root. Nope, not that one. It's the mandibular lateral incisor that has a rotation to the crown over the root. B, the mandibular lateral incisor is more symmetrical. Nope, it's the mandibular central incisor that is more symmetrical. In fact, it's the most symmetrical tooth in the mouth. C, the mandibular lateral incisor cingulum is displaced to the distal. That's correct. That's a characteristic used to distinguish the mandibular central incisor from the mandibular lateral incisor. If you hold the tooth, looking at it from the incisal, so that the incisal ridge is horizontal to your eye line, you can see that the cingulum is displaced to the distal. Let's look at D anyways. The mandibular central incisor is larger in all dimensions. Nope, that's not correct. The mandibular lateral incisor is larger than the mandibular central incisor. In fact, the mandibular central incisor is the smallest tooth in the mouth. So D is not correct. The correct answer is C. The mandibular lateral incisor cingulum is displaced to the distal. Which of the following pictures is of the left mandibular lateral incisor from the incisal view? Let's go over these images together. Let's look at A first. Here, you can see that the incisal ridge is horizontal to your eye line and the cingulum is centered. So this is a mandibular central incisor, not what we're looking for. Let's look at B. This tooth is positioned so that a line bisecting the tooth facial lingually is vertical to your eye line. We can see that the incisal ridge is twisted. In this case, The right side of this tooth is the distal of the tooth because the incisal ridge here is twisted towards the lingual. This is the mandibular right lateral incisor, not what we're looking for. Let's look at C. Here, the tooth is positioned so that the incisal ridge is horizontal to your eye line, and you can see that the cingulum is displaced to the side, to the right, to the distal. With this cingulum being displaced to the distal, I know that this is a mandibular right lateral incisor. Still not what we're looking for. Let's look at D. Here, the tooth is positioned so that the incisal ridge is horizontal to our eye line, and the cingulum is displaced. In this case, it's displaced to the left, and the left of this tooth is the distal. This tooth is the left mandibular lateral incisor, the correct answer.
The mandibular lateral incisor has one root and one canal, though a common variation is two canals. If there's two canals, one will be positioned lingually and one will be positioned facially. If you take a cross-section of the root of the mandibular lateral incisor, the mesial distal dimension is much smaller than the facial lingual dimension. So we've been going over the typical features of a mandibular lateral incisor. And that's where we're going to leave it, because the mandibular lateral incisor, like the mandibular central incisor, is pretty uniform, pretty predictable, and really doesn't have that much variation.
Attention dental students, now that you know all of the incisors, we can compare and contrast them, specifically the maxillary incisors and the mandibular incisors. Here's a quick table of some of the differences. The mandibular incisors have smaller crowns than the maxillary incisors. The mandibular incisor crowns are more smooth and regular, while the maxillary incisors tend to have grooves, pits, and depressions, as well as the lingual features of fossas, ridges, and cingulums being much more pronounced compared to the mandibular incisors. The roots of the mandibular incisors are ribbon-shaped, with depressions on the mesial and distal, while the maxillary incisor roots are cone-shaped. Mandibular incisors have one canal, but there's a very common variation where they have two canals. The maxillary incisors have one canal. The incisal ridge of the mandibular incisors is positioned lingually to the long axis of the tooth, while the incisal ridge of the maxillary incisors is centered over the long axis of the tooth. And finally, if the mandibular incisors have wear facets, they'll have a facial inclination and be on the facial of the incisal ridge, while if the maxillary incisors have wear facets, they'll have a lingual inclination on the lingual aspect of the incisal ridge. Which of the following incisors is properly matched with their trait? Let's go through these answers together. The mandibular central incisor commonly has a very deep lingual fossa. Nope, it's not that one. The maxillary incisors tend to have deep fossa, while the mandibulars tend to have shallow and hard to distinguish fossas. The maxillary central incisor is very symmetrical. That is not correct. It's the mandibular central incisor that's symmetrical, the most symmetrical of all of the teeth. The mandibular central incisor root is markedly wider facial-lingually than mesial-distally. That's correct. The mandibular incisors tend to have that ribbon-shaped tooth, meaning the mesial-distal is much narrower compared to facial-lingual. Let's look at D option anyways. The maxillary lateral incisor has consistent anatomy and little variation. Well, that's definitely not right. The maxillary lateral incisor is the second most varied tooth in the mouth. The correct answer is C. The mandibular central incisor root is markedly wider facial-lingually than mesial-distally. The mandibular central incisor is most likely to differ from the maxillary central incisor in which of the following traits? Let's go through these options together. A, the number of roots. Nope, the mandibular central incisor and maxillary central incisor both have one root. The number of cusps. Nope, neither of these teeth have cusps. The incisors, both maxillary and mandibular, have incisal ridges, not cusps. The number of fossa on the lingual. Both the maxillary and mandibular central incisors have one fossa, the lingual fossa, so this isn't correct either. And then D, the number of canals. The mandibular central incisor has one canal, but 40% of the time it might have two, while the maxillary central incisor has one canal. So this is the correct answer.
And that's it. If you found this video helpful, it would really help me if you gave it a like. Happy studying. Bye.